Hey guys, thanks again for being here. If you guys missed my video last night, I talked about most common and ridiculous male nurse stereotypes. And tonight I'm going to talk about, this is going to be part two. I'm talking about how to react to those stereotypes when it happens to you. If you guys don't know who I am, my name is Jason Rozinka, and I have been a nurse for the past 20 years. And obviously I am a dude, so I am a male nurse. And through these last 20 years, I've heard plenty of stereotypes, I've heard plenty of comments made, and some discrimination too. And I'm going to tell you just a few ideas I have that can help you how to react to these comments or this discrimination. It happens, and hopefully this will help you out. First of all, explain what you do as a nurse. You know, if someone has some kind of comment to make about you choosing that profession, most people have no idea what we do as nurses, including some of our spouses. You know, you can kind of explain, try to explain what happened today at work, and they get that kind of glazed over look, and it doesn't really compute if they don't know what you're talking about. I've had a ton of patients that I've taken care of that they're sick in the ICU and they're transferring out, and they admit that they have no idea what nurses actually do. They're at the bedside all the time. They barely see the doctors, and they're very appreciative of what we do. So just a simple explanation might help. Ask them why not. Why do you think that a man can't be as good of a nurse as a woman? Are you compassionate towards your kids? Men can be that way too. They can be that way at work just as they can with their kids. So women that have gotten into, have helped change things too. We have, more women doctors, pilots, going in the armed forces, driving tanks, flying airplanes, CEOs, and that's helped break a lot of the stereotypes too. Another thing we can talk about too is it depends on how serious it is. Some people can get kind of nasty, and if it's affecting how you do your work, if it's affecting patient care, affecting you outside of work, if it's really bothering you outside of work, even if it's getting very serious, try talking to the person. And if that's not an option, go to your nurse manager. That's something that you need to do, so this doesn't escalate and get worse and make you want to switch jobs. That shouldn't happen. It shouldn't be that way at work. Another way is be aware of where it comes from. There's simply some people that either for religious reasons or ethnic reasons just don't feel comfortable having a male nurse, and we need to be respectful of that. We need to be aware of that, and we have to be respectful of that, and hopefully that will help them be more comfortable in their experience in the hospital. Another thing we need to do is stay focused. If you're getting some discrimination at work, or if stereotypes at work, just stay focused and do the best job that you can. People that are discriminatory, it usually stems from inadequacies, and it's usually not the best nurses or the best coworkers that you're working with, or the people that are acting like this. They need to feel better about themselves. They have low self-esteem, and that's usually where it stems from. You don't have time for that. It's going to affect you in your job, and just move on. Last one I have here is just remember why you chose the profession in the first place. We chose the profession to help people, and through that you're gonna have great days and you're gonna have shitty days. It's gonna happen. There's no doubt about it. But just stay focused on that, on why you chose the profession in the first time. You chose it for the good days, and that's why you're there. And just stay focused on that, and don't let other people bring you down. All right, guys. We got to stick together. We're on this thing together. Hopefully this gave you some advice and some tips that you guys can go on. Take care. And if you like this video, remember to like, comment, and share. And I'll see you tomorrow. I'll be talking about how we can, what am I talking about tomorrow? How we can try to stay injury-free as nurses. It's huge. And it's your career. So you need to stay safe and stay healthy. All right, guys. Peace. Remember to play hard and eat well.